Houston Methodist Sugar Land Hospital recently unveiled its TrueBeam cancer radiation system. Dr. Clive Sketty explains how the TrueBeam will give physicians unmatched control of radiation therapy.
So this TrueBeam technology is the most advanced technology in terms of delivering radiation in Southwest Houston. With this machine, not only can we deliver conventional radiation, but we can do it more precisely, because on this machine we have an embedded CT scanner that we use to scan the patients before we treat them, so we can accurately reposition them to deliver the treatment as we prescribe it. Not only that, we can use intensity modulated radiation therapy, but we also have GPS system embedded in the patient that can track the patient as, for example, if the tumor moves, we want to know that, and the machine can track that. We have motion management, so patients, when tumors move because of breathing, for example, in a lung cancer, this machine can track that and treat the patient at certain phases of breathing, so we limit the amount of lung tissue that's treated and limit the side effects. This machine also has the ability to do what we call stereotactic radiation therapy, which is like a sniper shot. We are able to treat very small tumors close to very critical structures in a short number of treatments, 5 or less, with a great success of curing them. And so this machine allows us to do all those possibilities under one roof in your neighborhood, close to home, with the most advanced technology, with a caring and compassionate team that individualizes cancer care.
Dr. Dane Tanu explains what radiation therapy is and gives us an example of the TrueBeam's benefits.
Radiation therapy is pretty much the use of radiation to eradicate tumor in any body sites. For example, we have breast patients, we have lung cases, we have, it's like performing surgery without the knife. Like, for example, I just mentioned to you radiosurgery. Someone would have a certain type of tumor in his lung, for example. Provided it would meet certain criteria, we can use radiation to to take out that disease in the lung. In the sense that it's one of the best machines currently in the market. This is the first thing. It's very accurate, meaning pinpoint accuracy. So I've been saying this to almost everyone. I mean, if you had a Sharpie, for example, you would draw a line. That line would be about 2 millimeters. Imagine the thickness of that line, right? Divide that into 4. This machine is better than the 1/4 of that thickness of that Sharpie you would have. That's how accurate it is. So pinpoint accuracy. And the other thing also is that right now we have an integrated technology which allows us to track the tumor in time and space.
Dr. Sketty explains the team's effort in making a prognosis and the services available to its patients.
So at this hospital we have a comprehensive team of radiologists and pathologists who make the diagnosis of cancer. Patients are referred for studies, and if there's an abnormality found, the patient is biopsied, and with the aid of the pathologist, a diagnosis is made. So this requires a team of physicians to review all the images and the pathology to come to a diagnosis. So not only do we have the most advanced medical technologists here in terms of physicians, but we also have spiritual care, we have dietitians, we have speech pathologists, we have psychologists, and so we aim to treat patients as a whole, not just patients who have cancer. So as I say, I always view patients to be patients with cancer rather than a cancer patient, because you need to look at the whole patient, not just their cancer.
To learn more about the hospital's cancer program, please visit their website at houstonmethodist.org/Sugarland or call their cancer care navigator at 281-242-CURE. For Healthwise, I'm John Williams.